Well, good morning, members of the media, those that are following along on social media, and our employees that are watching throughout the organization. Here for today's January 20th, 2021 press briefing. I'm Bob Ravenscroft, the Vice President for Advancement. Let's go through the routine stats. We have 548 patients under our care as of midnight last night. As you can see from the far right on the slide, 71 of those are COVID patients. That includes those that are both positive, which is 60, and then others are in that still being treated but resolved category. As we go to the next slide, you'll see of these 71 patients, 7 of them are currently in our intensive care units, with 5 of them on ventilators. It's interesting to watch the county changes. The majority are now right here from Lancaster County, and you can see the dots on the map aren't quite as spread out as they have been. So I think that's playing a big part in our numbers for sure. Just real quickly on vaccines, there was an advanced question that came in on them, but I'll share some numbers for everyone. We now are at 3,980 employees that have received their first dose. 2,789 have received their second dose, so over 6,700 total. And then for providers and clinic staff throughout the community that are not Bryan employees, first dose, 1,473 individuals have received their first dose of the vaccination, 480 their second dose, for a total of 1,953 community provider doses as well. So all told, we have roughly between providers and employees over 3,200 people that have received their second dose and are working towards that 95% efficacy. And all told, 8,700 shots have been given. Yeah, I think that is absolutely fair to say they're improving, or at least I would say stabilizing. We're quite relieved and thrilled to see this. I guess that's the understatement of the year. We do believe it remains a tricky time. We have tens of thousands of young adults returning to our community. We're certainly not saying it's causal, but our ramp up to our darkest period coincided with colleges returning to town. It doesn't take too much digging to see that there's a lot being written on what has happened in campus communities, and we were certainly not immune to that. But I do believe we're in a much, much different place for the second semester beginning. One, testing options are much more widely available. And I would say, at least from what I'm observing in the community, there appears to be much less resistance to masking, finally, than what we had when everyone re-entered our community last year. I guess I would just say I think people are more cognizant of it and their role in preventing that. And as we've said before, really the public, not us, is the first line of defense in this. We're the last line, so it's incumbent upon all of us to continue masking, social distancing, hand hygiene, and keeping an eye on it. We are watching the new strains. We don't know what that'll mean. So until we get more people vaccinated, again, you guys are the front lines. Help us out with all of the safety measures we know that are important. Thankfully, no, it's been somewhat muted. Again, we're relieved with that. Just as a quick refresher, in June, we hit what we thought was an incredible high amount of COVID patients in-house, and that was 30 inpatients. In November, as you guys followed this, we got up to around 160 COVID patients at our high point. And it was a steady decline all through December and has somewhat stabilized or plateaued between that 70, 80, maybe up to 90, since the beginning of the year. The somber reminder for us is we have now reached 194 patients that have perished here under our care. So any possible decrease from holidays, I'd say it was a modest decrease to stabilizing. We're relieved for it, but the work continues for all of us here at Bryan and in the community. It's going really, really well here. Our first wave of employees in the wave 1 of 1A and a little bit of wave 2 of 1A were receiving the Pfizer dose, and they've received their second dose, and that was reflected in the numbers. Those employees that were in line for the Moderna and subsequent waves here will begin getting their second doses on Friday. So far, we're sitting at about 75% of our employees have elected to get the vaccine. The vast majority that have not were employees that were in childbearing years. They were currently pregnant or nursing, or they had had COVID in the past 90 days. After consulting with with their OBs and so forth, some of the concerns around pregnancy are alleviated, and I would encourage anyone to go to our bryanhealth.com and go to our vaccination research resources area, and there is information pertaining to people in childbearing years. So I would imagine we're going to be eclipsing 80% of our employees relatively soon, and anticipate over time that will go higher. I'll tell you where our plans are right now. We have plans for how we can handle vaccinations through some of our clinics, if asked. But our planning isn't really being restricted to those 65 and older. It's how do we set up clinics. I think it is worth repeating, Bryan Health or hospitals anywhere cannot go out and acquire vaccine and set up their clinics. In Nebraska, that is controlled by the governor, the state health department, and then regionally by regional health departments. So we kind of take our orders and try to help out them where possible. How we are helping out with the upcoming clinics, I'd say we're really connected with the health department. They have been great to work with. So first of all, for the public vaccinations, Angela Herbert, one of our directors that was but very instrumental in setting up the state's first drive-through clinic, data transfers to the health department, has been working with them as they set up their clinic, as has John Woodridge. For the clinics that are at Pinnacle Bank Arena coming up, the Lincoln-Lancaster County Health Department requested that we try to find 20 nurse volunteers and 6 non-clinical volunteers to assist. We have filled those positions, and I'm actually one of the non-clinical ones, and I'm really looking forward to helping out and volunteering in this role. Another way we're helping out is with freezer space. I believe they're going to be anticipating a supply of Pfizer vaccines. Again, they take the ultra-cold freezer space that we have, so we will be assisting them. I want everyone to understand they will be rigorously segregated from any Bryan supplies. So what the health department stores here for public vaccination is the health department's vaccination or vaccines. All we are doing is providing the freezers. Where we're really shifting our awareness right now is to those in our community that might be falling through the cracks with either, inaccessibility to the internet, language barriers, and so forth. I think you're going to be seeing in the very near future all kinds of mass communication on the vaccination effort. The Ad Council of America is doing some things. The Nebraska Hospital Association is planning some mass education. I know health departments are involved with that. So through our physicians and our employees, we're looking for influencers of how we can connect best with maybe some of these unreached groups in the community. So we're going to be very segmented. We'll have some education and promotion through our social channels, in-depth resources on our website, but we're going to really try to target and find that niche of where we can help members of our community that might have some barriers. I would just end with, and I think I'm speaking on behalf of all of us here at Bryan, we are incredibly grateful. We were in the phase 1 vaccination priority. It ensured our ability to work in a safer environment through all of this and keep doing our daily work, which the community and people in Nebraska so depend on. But through it all, we've been so grateful to the community that as we get through our second doses, we are eagerly looking forward to re-entering the volunteer workforce, things that, like at PBA, that we can do safely in our schools, in our churches, with other nonprofits, things that have been suspended. We look forward to shopping and dining again, and we're right at the cusp of doing that. And I think we feel that it's a responsibility of ours to be a significant player in restarting our local community and helping Lincoln reemerge as the vibrant community it was. Still is, but certainly was on the move as of last February, and we look forward to that restart. Nothing different than what Russ said. The vast majority of people have had the common things: arm soreness and maybe a slight fever spike and so forth. So those small numbers that he reported at the chamber is what it has been today so far. I think we're all looking forward. I guess maybe that's not the best way to describe it. We're going to learn more as everyone starts getting their second dose of the Moderna vaccine. Because that's the one kind of unknown variable we have right now. Is we know people who have gotten the first dose of Moderna and the very slight side effects, people who have gotten both doses of Pfizer, very slight side effects. So we'll learn more on Friday, but from all of the stuff that was disclosed in the emergency use authorization, we're not anticipating huge numbers of it, but as Russ reported, yeah, there were a few folks that had some type of reaction and needed to be kind of observed for a little bit of time. We do not want that to dissuade anybody because, again, if we go back to, we've administered now over 8,700 doses, and you're talking, 10, 12 people that had some type of observation required. I don't know the answer to that. My guess is we've probably seen a little bit of that because it is happening as we've been through this for the past year. We're all seeing the same information that the immunity from having COVID appears to last about 5 to 6 months. So those that had it last summer, they're certainly in a unprotected immunity position at this point. We will see if there's any precise numbers we can give you on second infections, but I don't have that at my disposal right now.